Let's talk about testosterone replacement therapy and prostate health. So starting with some background, the prostate is a male sex organ, so it's obviously affected by testosterone. The prime example of this is with prostate cancer. If a patient has prostate cancer that has spread outside of the prostate, say to the bones, and you take away their testosterone or castrate them, either surgically by removing their testicles or pharmacologically by giving them medication, and you lower their testosterone down to an undetectable level, the prostate cancer will essentially shrivel up and effectively disappear. Over years, eventually the cancer will learn to grow in the absence of testosterone, but taking away somebody's testosterone when their prostate cancer has spread does increase their survival, and it's still the backbone of metastatic prostate cancer treatment, or treatment of men with prostate cancer that has spread outside of the prostate. So we know that testosterone affects prostate cancer, and for that reason, people have always been cautious about prescribing testosterone for men because of concern that it could potentially cause prostate cancer. Although that's never been proven, it's always been sort of suspected just based on the physiology that testosterone has an effect on prostate cancer. The other example is with BPH, or benign prostatic hyperplasia, which just means non-cancerous growth of the prostate, something that is very, very common in men as they age and causes urinary symptoms, essentially difficulty urinating. In men with very large prostates and difficulty urinating, we can give them a family of medications like finasteride, which doesn't actually block testosterone. It's a little bit complicated. It blocks the conversion of testosterone to another molecule called dihydrotestosterone, or DHT. And DHT is actually the more potent form of testosterone, and it's responsible for a lot of things like prostate growth and male pattern baldness. So by giving finasteride or similar medications that block the conversion of testosterone to DHT, you can effectively shrink the size of the prostate and reduce the symptoms associated with prostate enlargement. Interestingly, the same medication at a lower dose, finasteride, is used for men with male pattern baldness, and it's quite effective. So basically, by blocking not necessarily testosterone, but dihydrotestosterone, you can alleviate a lot of the problems of prostate enlargement, even in the absence of cancer. So similarly, it has been suspected for many years that giving men testosterone replacement therapy could potentially cause problems with BPH, or prostate growth, in the absence of cancer. For this reason, these types of things have been very questioned by a lot of urologists, and people haven't really been sure what to do about testosterone replacement therapy. So there was a study that was published in JAMA, the Journal of the American Medical Association, in December of 2023. It was organized out of Harvard Medical School, and basically they enrolled over 5,200 men into the study and followed them for 4 years. The men were randomized into two groups, meaning they just randomly assigned each man to a different treatment. The treatments were testosterone replacement or placebo. Now, all of these men had met criteria for hypogonadism, or low testosterone levels, meaning they had done the blood test and they had the symptoms, so they were good candidates for testosterone replacement, and they also did not already have prostate cancer or any major issues with enlarged prostate. So they essentially took men with low testosterone levels but no real prostate problems and either gave them testosterone replacement therapy under the supervision of an expert in the field, or a placebo, basically no treatment. And then they followed them for 4 years, and they measured how different they were in terms of prostate problems. So obviously the first question is cancer. Did the men who got testosterone replacement have higher rates of prostate cancer? And the answer was no. They did not have any higher rates of prostate cancer, and they did not have higher rates of more aggressive prostate cancer. The prostate cancer rates were the same no matter how you look at it. Then the second question was, did they have more problems with enlarged prostate? Did they need to have any procedures done, surgeries done on their prostate to help them urinate? Did they need to start any new medications to help them avoid problems with their enlarged prostate? Did they need to have any catheters put in? Any sort of problems related to an enlarged prostate? And the answer was no. There was no difference between the two groups. So this is a real landmark study that shows that if you're a man with low testosterone and the symptoms of low testosterone, and you undergo treatment under the supervision of an expert in the field who's monitoring you and managing your treatment appropriately, you don't have any increased risk of prostate cancer or symptoms associated with an enlarged prostate. So this is definitely good news for men with low testosterone, and it's a very good study and worth knowing about.